Hello, this is Unit 9 Journal. This is my experience evaluating a patient for the first intake evaluation, just a 55-year-old female of Hispanic origin. She does have a past psychiatric history of generalized anxiety disorder and unspecified major depressive disorder. She presented to the crisis unit of the behavioral health wing on a voluntary status with the chief complaint of acute alcohol withdrawal. And her last drink was 1 p.m. of the same day that she arrived to the crisis unit. Patient was a little hard of hearing but was able to understand speech if spoken to without a mask. She was recommended, she arrived to the crisis unit after she was recommended by her PCP for excessive Xanax use. This Xanax was prescribed to her by the same PCP. The order was for 0.25 milligrams Q6 hours, but according to the PCP's note, when the PCP called the crisis unit, the patient had taken 40 pills of Xanax within 14 days. So that was a very excessive use. Patient was also self-reported that she was drinking heavily for the past 6 months, about 3 bottles of wine a day. She was only primarily consuming wine, no other alcoholic beverage. Upon interviewing, patient was very pleasant and cooperative, linear thought, normal rate of speech, normal volume and prosody, linear and goal-directed thought, no perceptual disturbances, no hallucinations, no signs of psychosis or delusions. Patient vehemently denied any SI/HI, had no past history of SI or self-harming behavior. She had pretty good insight, as I discovered throughout the interview, because she did identify that excessive alcohol consumption was the cause of a lot of her problems, and she could foresee that it can eventually lead to bigger problems that which she wanted to completely avoid. Patient described that her favorite things to do were hiking with her dog. She visits a lot of state parks and national parks around the state as well as around the country, where she's taken her dog for a hike. And she also enjoys watching movies. She currently lives in her own home and recently has had a roommate since past December. She says her roommate is very pleasant, very friendly, and she enjoys her company. She also calls upon her roommate as her big social support. Outside of that, patient does not have any significant family members. She is single. She has a brother who lives in Seattle and also checks on her once in a while. She was very upset that her brother was unhappy about her drinking problem, wanted to do something about it. Patient had one past psychiatric inpatient hospitalization in 2018 when she was excessively using hydrocodone prescribed for her back pain, and she sought medical help to wean off of opiate pain medication use. She has not used any opiate pain medications since her discharge in 2018. Patient reports that what started as 1 or 2 glasses of wine every day in the past year kind of developed into this habit of drinking 3 bottles of wine a day, and now her constant thought is that when her next drink is going to be. She's a pharmacy technician. Currently, she describes she just does not have any issues with her job. She does not want to lose her job over this habit. She loves doing what she does and wants to maintain her home, maintain her job, go back to doing her what she enjoyed doing, like her hiking, watching movies, and wants to kind of recover her financial losses over this habit. So patient was very motivated to undergo treatment we suggested that she be placed on Valium taper, but for the time that she's here, so that's going to be a 3-day inpatient treatment, and then patient will continue outpatient treatment with her psychiatrist. Upon her discharge, social work will find therapy appointments as well as a psychiatrist to maintain treatment regimen for generalized anxiety disorder and MDD, and also monitor her abstinence against alcohol. Patient was quite cooperative and agreeable to this plan, so we will see how that goes.